All right, let's talk about the healing process of incisions. Incisions are common whenever we make and remove some skin, we leave an incision. So the incisions I'm talking about are those that are in the healing process. Generally, you'll start seeing as they heal over the first few weeks, some areas of tension where the skin can separate a little bit. And if you see that, it's nothing to worry about. So how do you manage areas where the skin's separating a little bit? And we'll show you some pictures just to kind of give you an idea. But we do get a lot of our guests will text us, and we have no problem with responding to text, but I want to ease your anxiety. If you do see a little area on your incision that has a mild separation, there's nothing to worry about it. The skin heals on its own. But things that you can do: make sure you're eating and drinking your 100 grams of protein a day, and then making sure that you're taking some over-the-counter collagen peptides. It's just a powder. Do 2 scoops of it, take it daily. That's really gonna help with your incision care. Listen to us as far as whether or not you're supposed to wear your scar tape, and listen to us we'll also talk about whether or not your incision's dry or if it's a little bit moist. We'll tell you how to care for it. But I guess the main thing that we wanna let you know is it's very, very common. And so where do we see it? On breasts, we often see it on the vertical incision going down if you've had a breast lift, in and around the areola. On the arms, you're moving your arms all the time. And so you can't walk around just like a mummy if we've done an arm lift. So you'll see little areas on the arms with mild separations. You can see in this patient, the arm lift, she has a small little area she put an arrow to that has a small opening, and that yellow is just normal healing tissue. The next picture, again, arm lift. You can see some little pleats there. Those little pleats or wrinkles will all heal up, as well as the little openings will also heal up just fine. Just reassuring the patient. This patient had a tummy tuck incision. That's very common to have a little area there. That is due to normally a little hair follicle growing underneath the skin. This lady, you could see, has an incision along her breast. It does look kind of red, and it looks like the skin's separating. And then just with time, a few weeks later, you can see how the skin heals up nicely. The skin's closed, and that pigmentation on the top part will all just fade with time.